One of the additional tests that is done is antimicrobial susceptibility testing. And so this is when we try to figure out which antibiotics are actually going to inhibit the growth of that particular organism. So you've done the urine culture, you've worked it up, you've figured out that the patient has an infection of a particular bacteria. Now let's figure out which antibiotic is going to work, because over time there's certain bacteria, because of their cell wall makeup or other factors that are involved, they can become susceptible to bacteria, or that bacteria just is not able to kill that particular organism. So doing susceptibility testing, there's a couple of ways that this can be done, but basically you're looking to see if the organism grows in the presence of that particular antibiotic, or whether or not it is resistant. If it grows in the presence of it, it is resistant. However, if it does not grow in the presence of it, it is susceptible. So here we've got an image of a culture plate in which the bacteria was spread out on the plate. So they made a lawn of this bacteria, and you'll learn more detail of this. And then they placed all these little antibiotic discs. So these antibiotic discs are placed on there, which allows the antibiotic that is actually in that disc to kind of start to leach out into this agar. And as it leaches out, then of course the closer it is to that disc, the more concentrated it is, and then the further out away from that disc, and then the leaching of that antibiotic is actually getting a little bit weaker as it leaches out. So when you're looking at these, you would actually take a ruler and usually look at the back of this plate, and you're measuring the distance that it takes. Well, actually you wouldn't do the side, you do more of the center, but you're measuring that distance across there. You'd get a special ruler out and do that measurement, and then you'll determine based on what that value is, whether it's considered susceptible or resistant. So of course, something like this, where the bacteria grew all the way up to the disc itself, we know that it's resistant. The organism continues to grow even though that antibiotic is there. Whereas susceptible, now granted, most of these look like they responded, but it's without knowing what the values are supposed to be. I'm not really sure if these are considered susceptible or intermediate, somewhere in between. But you'll get more detail on this later. So to take that a little step further, so we're looking at the minimal inhibitory concentration, the MIC, which is the dose of antibiotic that you can give the patient that's going to be low enough to actually cause that organism to die or to kill off that organism. And we measure this in the micrograms per milliliter. And so here is an example of an E-test, which is a strip of that antibiotic that's actually kind of impregnated into that little paper strip. And then that's placed on that lawn of bacteria. And then the antibiotic itself is actually kind of diffused out, just like it was with those discs. And so you'll read to where that bacteria actually grows to, and it's somewhere kind of, it's right up in this area. You kind of see where it's kind of starts, the growth pattern starts right in that area somewhere. So that's the stronger dose of it is back here. You've got more antibiotic, whereas you have less antibiotic here. So we know that our lower dose is in this area down here at the bottom. So if we look at this and we're trying to figure out exactly what is our minimum inhibitory concentration of this, then we need to round up, because we're somewhere around 1.5, give or take. It's right there at it, but it's closer to the 2. So we'd actually round up to the 2 micrograms per microliter. And so that would be the result that we would report out as far as what the lowest value of that concentration of that antibiotic could be used. And then there's a broth testing method. So we've seen the strip test, we've seen the disc test, and then there's a broth method in which those broths are actually diluted out. So again, more of that dilution. So depending on what the dilution is, it could be a 1 to 2, 1 to 4. Of course, these aren't it, but kind of get an idea. And of course, it keeps going, but that's probably not what these are. They're probably a lot different than this. But you can see in this first well that you actually have growth inside of these wells. So you got this organism that is still growing. So it grows in every well, which means it's resistant. And then this particular one, you can start to see some growth here. Yeah, you can see that little dot there. And then you can see it getting a little bit bigger. There's more growth. So the less antibiotic that's in this solution here, the more it's able to grow. So usually somewhere around 80% reduction in growth is considered a reaction. So I'm not really sure how if most of these things are going to be put on an analyzer. So I'm not sure how it's going to score it, whether it's going to score this is the minimum or this, because it does look at a variety of things when it's scanning those. This particular one, you don't see any growth in any of these wells, so it would be sensitive to every concentration. Here's some more examples down here at the bottom. So you can kind of see where you're looking for actual growth in those wells to do that microtiter plates. You can also do this in tubes, so you would set up the tubes and do the dilutions in the tubes. So this would be more of that serial dilution where you have several tubes that have a different concentration in each tube, and of course you would have the bacteria introduced into it, so you'd make sure that everything's kind of equal as far as the amount of bacteria introduced and whatnot. And then you're looking for the turbidity or the cloudiness of it to see if you still got anything present, or even just a clump of bacteria growing at the bottom of it. So you can do the susceptibility testing a few different ways.